to cover over the next few months. We also talked about how can we get everybody more up to speed on the CIP plan, where that money is going. And Ned Galloway and Diantha McKeel are both going to be doing a budget discussion together. So anyway, we'll take care of that. But we also have built kind of an interesting agenda, I think, for the next, not agenda, but topics for the next few months. And today we're going to start, and the kids were one of them. That was one of the things we talked about. But we also wanted to have a bit of a COVID update, since I'm obsessed by that, and make sure that we know what's going on. We thought it was important to remind everybody about FOIA, the long arms and the long reach of FOIA, the development process overview, just to make sure, because we've got a few people who haven't been on as long as I have. So we keep thinking about, some of these topics we need to cover periodically. And then some community member updates. That is our agenda. Does anybody have anything they want to add, remove, change? Okay. The minutes. We missed Rosemary last time. You're so good to be taking minutes. Did everybody get the minutes?
We did a few minutes ago.
Oh, is that?
Oh, no, I beg your pardon.
No,
Actually,
Agenda.
Do we get minutes?
I think that I don't think I got any from last month, and that was a carryover on the agenda. So I'm sorry about that, Cynthia. I think that we might.
Yeah, no, it was like all of a sudden as I'm looking at Rosemary, I went, I don't remember seeing them. So, okay, this shows how bad we are when somebody like Rosemary is not with us, that we can't even manage to backfill her. But anyway, we're all here now.
Cynthia, I'm getting a text from Samantha from Stonefield who says she's muted. She's trying to let people know she's here. I wonder if she's somehow or another on
calling in, you think, Diantha or Supervisor McKeel?
It's Diantha. But let me see, because I don't see anything. Let me ask her, okay? Sorry to
always hesitant to promote phone numbers without knowing who they are.
Well, the other thing is that you needed to use the link, the most recent link we got.
Right. She's responding back, and I'm sorry to stop the meeting. This is kind of wackadoodle. She says, I'm listening in now, but she must be on the other. Yeah. If I tell you what, Michaela, put in chat where I need to send her, and I'll text it to her, and then we can keep going with the meeting if that's
right.
All right.
Sure.
Thanks.
Okay, so the great thing is we have the lovely Emily Kilroy, who's looking very glamorous these days. But she is going to talk about my favorite subject, COVID. Right?
Is that my intro?
Do you want more? I can go on forever. But
no, that was very wonderful. Thank you. And while we were working on the getting all the right participants in the right spot, I added a new slide because Cynthia, I did not put data originally when I was planning on presenting. So I slipped in a data slide that is not on my agenda, but nevertheless in the presentation. So thank you everyone for having me this evening. I'm Emily Kilroy. I'm the Director of Communications and Public Engagement for the county. But tonight I'm really more speaking as part of the regional team of public information officers. Whenever there is a large event in the city, county, university area, there's sort of a mobilization of depending on what is going on, it's a different team of folks, but a pretty regular mobilization of folks to make sure that we're all sitting around the same table, operating off the same information, and putting the right resources in the right places so that we're not duplicating efforts across the city, the county, the university. We do this, normally when I'm talking about what the regional emergency operations look like, I'm talking about flooding events or massive fires. There was a spin up when the train when there was a train that hit a garbage truck in Crozet a couple years ago. Never on my list did I have pandemic, but here we are. And what we do is, again, depending on what the incident is, you bring the professionals that work in the right spaces to bring supplies together, to run logistics together, to run communications together, so that we're making sure that everybody has the right information, that we're all speaking the same information out, and that we are able to really leverage the resources that the different organizations have. So we have been a big partner with the Blue Ridge Health District, which is formerly the Thomas Jefferson Health District, for many, many years. And we do work with them sort of a matter of course regularly. So it's not only during emergency incidents that we are working with the Blue Ridge Health District. And so with that, I'm going to share my screen. And I coach people on how to do this. So if I do it wrong, it's really embarrassing.
You got it, babe.
All right, I'll put this in. Okay, we good?
Good.
Great. Okay. So this is an update. This is part of a data dashboard that you can get on the Virginia Department of Health's webpage. I'm hoping everyone has seen this. This is a zoom in on the Blue Ridge Health District. And what I want to point out on this slide is the chart is the number of new cases per day. And you can see a really big spike, sort of almost centered on January 1st, 2021. And that is what's been characterized as sort of the surge that came following sort of the Christmas, New Year's holidays. You can see on the chart, there's a spike that sort of began around Thanksgiving and really picked up a lot of momentum towards the end of December. You can see that crested in early January and it has started to come down. There's a lot of data to suggest that holiday surge is waning. But, I think one of the things that as the vaccine has come closer to really shots in arms, as we kind of like to say, we like to try to remind folks that we are still very much in the middle of the pandemic. And even once folks start getting vaccinated and are getting vaccinated, you still have, that does not change your day to day. So you are still wearing a mask, you're still keeping distance, you're still safest at home, you're still doing all the things that we've been doing for the past many months as we work to really expand the number of people who've been vaccinated, and some of the challenges with the vaccines that I'll talk about in a minute. So here's my actual agenda. Talk a little bit about the vaccine, what it looks like in Virginia, in our health district, what to expect when you get to schedule your appointment. What does that mean? What does that look like? And then again, sort of post-vaccine, a reminder. So vaccines. A lot of us are learning a lot about vaccines very quickly. And a couple of things that we like to point out is that the FDA, which is responsible for oversight of Food and Drug Administration in the United States, is that they have to authorize drugs before they can be released for use to the public. But they don't grant the emergency use authorization unless a drug or therapy has been proven to be both safe and effective. So while the timeline for the vaccine development for COVID-19 has been much more rapid than other diseases, other viruses, those two minimum bars have to be met for emergency use authorization to be granted by the FDA. So right now there's 2 vaccines that have the emergency use authorization. There are several more under development, and we will know a lot more in the next several weeks about what those other vaccines will do for administration of the vaccine, as those come closer to approaching approval. They're still under testing, and the test results are still being validated and reviewed by the FDA. And one of the things that is sort of interesting about the vaccine development process for COVID-19 is what we expect we'll have is several different kinds of vaccines. So the 2 that we have authorized for use today one by Moderna, one by Pfizer, are both mRNA vaccines. And the way that those work are, they teach our cells how to make a protein or a piece of a protein that triggers an immune response inside our bodies. So that immune response produces antibodies, and antibodies protect us from getting infected if the real virus were to enter our bodies. That's how the two Moderna and the Pfizer work. The other vaccines that are sort of still under development that you may have read about, the Johnson & Johnson, the AstraZeneca, those use different methods. Those are not mRNA vaccines. They have different methodologies for how those work. But so the two that I'm going to talk about, or what I'm going to talk about, really pertains to the two Moderna and the Pfizer. Both are requiring two shots to be fully effective. So you get your shot the first day, and then depending on which company's product you get, they'll tell you to come back in 21 or 28 days to receive a second shot. And that's sort of a booster that, based on their studies, will provide the best level of immunity. The efficacy rate is very high, almost 95% for the two of them. And that is, that's a very high number as far as vaccines go. In Virginia, and this is sort of a Virginia government 101. In Virginia, the health departments, unlike other states you may have lived, are not part of local government. They're actually it's the Virginia Department of Health runs all the public health services in Virginia and the Commonwealth. And they do that with health districts, which provide the direct services to localities. So Albemarle County doesn't have a health department, but we are served by the health district. And they have, so VDH has said that, that the health districts will be responsible for administering the vaccines. And the administration is going to be in phases, which the CDC has recommended. And there's a combination of factors that go into the phases. One is your exposure risk based on your employment. So many of you are aware that the first folks to get the vaccine in frontline nurses, doctors, surgeons, those working in hospital settings who are coming in contact with COVID positive patients on a regular basis. The other factor that they're looking at are health risk factors. So age being sort of the principal one, and then comorbidities or other underlying health conditions that make COVID-19 a riskier individual situation. So there's some links on here, how many vaccines have been administered. There's a data dashboard. You can also access that off albemarle.org. There's a red bar at the top of our webpage that puts together sort of a localized for our district look at where we are with cases and vaccine administration. And there's also the Virginia Department of Health has put together sort of a tool. You respond to a couple of questions and it tells you what phase you're in. And again, it's all based on your what your employment is and other health risk factors. So where are we in the vaccine administration? Right now, we're sort of in a blended 1A and 1B. The state said would move to phase 1B on January 18th. There are still in the Blue Ridge Health District some phase 1A eligible individuals who have not been vaccinated, and they are working to prioritize those folks as they also start to work on the phase 1B. And you can see on the graphic sort of who is in 1A and 1B. A couple of things that are really important to note is there's a blue bar under the graphic. About half of Virginians qualify under phase 1A and phase 1B. So that's several million individuals in the Commonwealth who are eligible. And based on the current rate of vaccine availability, it will take many months to get through phase 1A and phase 1B. In the Blue Ridge Health District, again, we are currently on 1A and 1B, and the goal is to complete each phase before moving in earnest into the next. There's a dual need to ensure that, we're making sure that all of the vaccines we have available are able to be used. And so there's a little bit of an overlap between 1A and 1B in order to ensure that we have vaccines getting to the right place as quickly as we can. If you do qualify as phase 1A or phase 1B, you are able to register with the Blue Ridge Health District. They have some forms up on their website that, that you can respond to questions and get on their list. And when the Blue Ridge Health District is ready to start to invite you to schedule an appointment, you'll get an email from the CDC that says that you're welcome to create an account in what they call VAMS, which is the Vaccine Administration System. And so some people have submitted the survey with the Blue Ridge Health District and have said, well, why haven't I gotten my offer to register with the system yet? And that's because Blue Ridge Health District may not be ready quite yet to actually start scheduling your group. So they're prioritizing 75 plus over some of the other ages that are currently eligible. And so as they flow through availability, they'll start approving you in their system and then contacting you to schedule an appointment. And then you register with the site once you get your email from the CDC. And once you register, that opens up a calendar of available appointments, and you can pick an appointment off the calendar and then come to get vaccinated. And right now, the vaccination site in Albemarle County and the city and serving the city of Charlottesville is the Kmart tent that I'm sure many of you have seen in your travels. And that is the central location that is serving our region. This is not a scientific schematic I'm about to show you, but what happens when you get to the tent? Some people have asked, is it a drive-through? You just queue when the tent is really just for the personnel that are working there? You actually do go into the tent. So when it is your day and time to go get your vaccine, you'll park and go into the tent. There's an on-site check-in to make sure that you are who you say you are and that you are there at the right date and time. Then you'll flow to the next area, which is where they administer the vaccine. And then you'll flow to the final area in the tent, which is the post-vaccine observation. Some of you may be aware there's been news reports of and documented anaphylactic shock or anaphylaxis reactions to the vaccine. And so they've built into the sort of the process for vaccinating in Virginia a 20-minute observation period where they have licensed medical professionals in that part of the tent, and they're just there in case you have a reaction, and they have the appropriate medications available to assist you with. And then you're on your way. So there's been a lot of question in the community about, are we doing enough to sort of meet the need for vaccines? And the health department has, over the past several days, gotten some clarity over the next 4 weeks how much vaccine that they will be provided to administer locally from the state. And those numbers are, in Virginia, there's about 100,000 vaccine kits, which include the syringes, the alcohol prep pads, sort of everything they need to be able to deliver a vaccine. The state is getting about 100,000 a week from the federal government. The state is allocating those to the health districts by population. So the amount of vaccine that we get is just based on how our population relative to other districts in the state. And so that for the Blue Ridge Health District translates to 2,950 first doses per week for the next 4 weeks. Right now, that is the rate limiting factor on vaccine administration in the county. To do the whole central Kmart vaccination clinic setup, they need trained vaccinators who have received a special training. It's not just any medical professional that is licensed to administer a shot is not automatically able to administer this vaccine. The mRNA vaccines require special preparation, special delivery mechanisms, and there's a specialized training that you have to complete in order to be licensed and trained to be able to do that. So there's vaccinators, there are having the right folks who have the right certifications to be able to be in that observation area of the tent to ensure that we're able to respond if you do have a reaction. There's also just the physical space, keeping everyone physically distanced and making sure that we have enough space to run the vaccine sites effectively, and then the kits themselves. And again, you'll recall that these mRNA vaccines require two shots on 2 different dates. The city, the county, the university, the 2 health systems have been working really hard to mobilize resources to resolve the vaccinators, the observers, and the physical space. So again, right now, the pinch point is the number of vaccines, but we are building the infrastructure so that as we expect the volume of vaccines to increase over the next several weeks, that we'll be able to put the right resources in place very quickly to be able to ensure that we're getting appointments up and available out into the community. Again, if and when you do receive your invitation to select a time, a date and time to get your vaccine, you have to do it in the district in which you live. And that is particularly true if you're qualifying for your health risk. And if you're qualifying for your employment risk, you have to register in the district in which your employer is located. Again, because those vaccines are being distributed by district. And so they want to make sure that they're matching as they do their estimation for where to send the shots, that the numbers are sort of evening out, and they're making sure that they're matching people to vaccine. And so, even as we wait for vaccine to become available, and even after you receive your vaccine, they still are asking that folks continue to take the same precautions that we've done for several months. And there are a couple of reasons why. One is there's not currently enough testing data available to have the CDC feel comfortable recommending that people stop taking those precautions. So we don't understand enough about the real world implications of the COVID-19 vaccines to understand if it's safe to take your mask off or not. And so in order to ensure that case counts don't overwhelm our medical professionals at the same time that they're trying to run a very complicated vaccination process, that we continue to observe all the same precautions that we have. And we just don't know if we know that the vaccines can prevent, if I have the vaccine, it does a very good job keeping me from getting sick from COVID-19, but the data is not quite there yet on if it allows me to continue to be a potential carrier or spread the virus. Again, there's been an incredible amount of coordination, collaboration in our region. The county, city, and the regional emergency communication center and the health district meet many times daily. There's several connection points during each week to ensure that we're all mobilizing the right resources and staying ahead of the needs. The health systems have their own allocation of vaccine that was given to them by the state to take care of the medical personnel that work with them. And are also some private pharmacies operating in the area who have a contract with the state to specifically administer vaccine to the staff and the residents of long-term care facilities, because those have been an area where we've seen the highest levels of outbreak in the state over the past several months. And so that they were prioritized as phase 1A. The best sources of information about vaccine are the health district and the Virginia Department of Health. They both have hotlines available. And I encourage everyone to take those numbers down and reach out with individual and specific questions. And then their websites also have a lot of information as well. And again, very strongly hoping everyone hears the message that we'll continue to advise that you gather only with members of your own household, wash your hands, wear a face covering, and maintain 6 feet of distance when you are out and about in the community for the foreseeable future. And with that, I will do my best to address your questions.
Okay, we're only gonna have time for a few. Bill?
Yeah, I have some, about 2 or 3 very specific questions about the sign-up process based on my experience. So if you don't know the answer to this, I understand it. But initially, when they changed phase 1B, they made it available to people only 75 and older. And there was a survey up on the website of people 75 and over. I filled it out, and I was supposed to get a return email, and I didn't get it. Well, I know now that it went into my spam filter, but at the time I thought, and then that was on the 9th that I filled that out of January. Then on the, then they changed the form. They took away the 75 and above, and then suddenly there is a 65 and above form. And I'm sitting there, well, is the old form operative or not? And so I filled out the second survey, and that was on the 15th. On the 18th, I got an email inviting me to sign up for an appointment. I did that, signed up for last Friday. I got my first shot. I
At
made,
UVA?
yeah, UVA, and I made my appointment for the second shot. Now my question, but I know somebody in the 75 and over group who's very frustrated because she knows people who've already got their shot. She hasn't received an invitation. And so my first question is, are they going to work through the entire group of people who signed that first survey before they take a younger group of people in from the second survey? Do you happen to know?
They are working to ensure that they are getting this, they are working to prioritize the 1A folks above the 1B. So folks will get, folks will get an invitation depending on their employment risk for 1B at this time. But right now they are working really hard to ensure that before they open up further appointments to a wider group of people, that they work through the phase 1A.
Oh, I understand that, but they're open now. I mean, I've had my shot based on my age, and believe it or not, last night I opened my email and I had yet another invitation to sign up for an initial appointment. I assume that's from the second survey I signed, the 65 and over. So, but if there's people still in the 75 and over group, it seems to me if they have the priority.
Yeah, you need to call the hotline, the Blue
Yeah.
Ridge hotline.
Yeah. And my
But
other,
yeah, the intent is that the 75-year-old, 75 and older year olds will be prioritized ahead of the 65.
They're using excess vaccines that UVA has.
yeah.
That's
And the other thing I'm
largely where
hopeful
they're
for is that they, on the second appointments, that they don't start doing things like, switching between Moderna and Pfizer, or delaying the second shot for any amount of time. The CDC has just flipped on that. They're saying, well, maybe it is okay in unusual circumstances. And they're saying, well, maybe we can delay the second shot up to 2 weeks. But if you start going down that road, you don't know what it's going to do to the efficacy of the vaccine. So I hope you will work with them and suggest that they not start. I mean, I have my appointment set up for the 3-week period, and I hope those will be prioritized, is what I'm saying, over.
So out of the 2,950 a week that I referenced is for new shot appointments. They have a separate allocation of shots for second shots because they really want to make sure that they're hitting those the 21 or the 28-day turnarounds that are necessary. And at this time, they are working to manage. They are working to manage to ensure that if you're on the 21-day period, that they will get you your second appointment in that 21-day window, and if you're on the 28, the same. But they are working through right now a list of folks who they have in the system as having had their first shot to ensure that they have an appointment for their second shot on the appropriate time window with the appropriate vaccine. So right now they are matching. If you receive Moderna, you'll receive Moderna, and if you receive Pfizer, you'll receive Pfizer.
I think that's important. I mean, it takes good planning, but I think they're perfectly capable of doing it. And I hope they don't start letting these things slip, because there might be a temptation to try to get more people in and put the second shot off for another 2 weeks. And that's what concerns me.
Anyone else?
Hi, Emily. Thanks for, can you hear me? Thank you for all your work on this, which is great. I was just wondering if 50% of Virginians are in these first two groups, if they have any estimate or if it's just too soon to know because you don't know what the, how quickly you'll get things. But if for people in those later groups that are working from home with no other issues, if there's any indication if it's, you know, next Christmas or what kind of timeline it might be on. How long is that tent going to be in the parking lot?
That is a great question. And, you know, I think I referenced earlier there, some of the other vaccines don't have some of the same challenges that these mRNA vaccines have. And just in terms of the special handling that is required, many of you know there's a cold chain management that is required on the Pfizer vaccine. Some of the other drugs that are still under development have much more straightforward, a single dose, a dose that can be kept at much more available temperatures. And so as those things come online, that will really change the timeline for full administration. Unfortunately, right now, we don't know what that's going to look like because that's all based on FDA approvals and also production. And so, you know, we know for the next 4 weeks that it'll be 2,950 for our region. And
there's no new appointments available for the month of February. They're booked.
Yes, based on that number, they've not created additional appointments. But we hope, you know, the health districts are in regular communication with the state, and as the state gets updated information from the federal government about availability, we'll continue to make sure that again those appointments get put on the books to be able to be used as soon as we know that we have vaccine to be able to deliver. I think that the biggest concern right now is allowing people to create appointments, not knowing that there'll be vaccine to deliver to them, and then the frustration and the resentment that will really start to brew if we have to cancel appointments because vaccine is not available. So,
I think one of the things, I have several questions that I'm just going to email you, but like, there's a couple of them like employer vaccines. You know, I've been checking with some of the bigger employers and some of them, like Wegmans is going to apparently in the next week or two, start doing employee your vaccines through their pharmacies. So I'm curious, where do they get their supply? But then other stores like Harris Teeter, no employees ever heard of it. They're not doing anything. So I think that's, you know, how do we make sure that all, you know, essential workers are getting a vaccine at some point? The other is that I heard today from a couple places, you know, you have to have email to be able to make VAMs work. And some places like down in Yancey, you know, communities down there of color are wondering, you know, does anybody remember we're down here? So I think that needs to be focused on. I was also going to mention, as Diantha and Julian know, there's going to be a Big Lots. It's the old Big Lot space is opening up, and we'll see there. But so anyway,
I can very quickly hit those too because I think those are good ones for folks to hear. The regional emergency operations center is working to contact all of the businesses that are covered under 1B to reach out to them directly to say, here's exactly how you get your employees registered. And then the other is the question about email. When VAMS launched, it was email only. The health department's hotline now can, if people who don't have email call the hotline, they can triage over the phone to get someone an appointment. So the hotline is the best number for someone who needs help with email.
it's good.
Cindy, I have a quick question.
Okay.
Have you heard anything about whether just family physician practices are going to be getting vaccinations? And I mean, if you're already,
so. I mean,
is everybody going to have to go through this system and this go to the tent? Or I mean, is your family physician able to do this?
At this time, it's just through the health department.
It is going to be only through the health
Well,
department. And then one other quick question.
It's not. Wait, I talked to a physician today who their medical group was given 500 doses of vaccine about a week ago. And they not only got it, but they also distributed it according to their own methodology, which I question. So you know.
then are people, when they get a vaccination through the health department, are you getting some kind of documentation of like what you got? And like, you used to get vaccination cards. Like how do they give you like documentation around this?
Oh, there you go. Mr. Love is showing one for folks who can't see it right now.
What
There
is
is and so the kits that I referenced that have the alcohol preps and all that in them, the kits themselves include a card that has your name and contact information, and then they fill in the date and the drug type that you receive.
Does it have a lot number or any other like identifying information about the batch or lot that you're getting? I mean, if you look at my child's vaccination comes with like the sticker of the lot that he got vaccinated by. So I was just wondering if this is.
My understanding is it does, yes.
The card I got does not have the lot on it though. The one
It
I got
doesn't.
already.
But
It
understanding
may
was
be in
they
the
were
system.
recording, not lot numbers. I don't.
Yeah, it might be in the system somewhere.
It's recorded in the system, so
It is.
and that's why they are working so hard to ensure that folks get entered into the system, whether it's over that hotline. Again, if you don't have internet access or an email address, so that because that has a direct connection into the state's immunization record system, so that they can track that kind of stuff.
Okay, Jane.
When I got my shot, they gave me the card, and a friend of mine had talked to her physician, and physicians were saying you should keep the card after you've had your second shot, keep the card, get it laminated, and keep it in your purse. I mean, like I'd keep mine with my passport, because you really need it to get on airplanes, to get on any kind of any kind of public service, that goes anywhere outside of town. So it seems to be quite a vital instrument that you should keep on you.
Yeah, no, I've heard that too. Okay. That was really a great conversation. Emily, you're our hero. Thank you. Thank you. I see Samantha's here. I was gonna let Diantha introduce our newest CAC member. Diantha.
And we're thrilled that Samantha got on. She texted me and said at one point that she'd get back to me as soon as she stopped driving. So it looks like, Sam, you are home.
I am. When you have a 2-year-old at home, I have to like make it home. So I was in commute during the meeting, but I was listening to everything, and what an awesome meeting. I told my husband, I said, you would have loved this. You would have loved listening in on all of this.
Well,
So let me just back up a minute. So Samantha is the manager now at Stonefield. So she is our connect not only to everything that's going on wonderfully at Stonefield, but she's our conduit. And if you all will remember, Victoria was the previous manager. And the last time I heard, she was on a ski slope somewhere. So.
In Vermont, to be specific, we spoke this morning.
Right. So welcome, Sam.
welcome.
Is that all right?
Please call me Sam. Yes.
Okay. Welcome, Sam.
Hey,
Thank
maybe
you.
someday we'll be in person again and we can actually shake hands or something. Wouldn't that be
Fingers
fun?
crossed.
Okay, so thank you very much for doing that, Diantha and Sam. And now Michaela has the opportunity to try to talk about FOIA and conflicts of interest and get the same kind of interest and attention that Emily did about COVID.
Thank you, Cynthia. I'm going to share my screen, and I realized that this information is maybe not quite as timely as the COVID-19 update, but hopefully will still be valuable to everyone. And I'm just sharing my screen here. Can everyone see that?
Yes.
Okay, great. So before I jump into the details of FOIA and COIA, I thought it would be helpful to back up and just talk about the purpose of the CAC for a moment, the community advisory committees. I know we have a couple newer members, and while this might be repeat information for other folks, it's, as Supervisor McKeel mentioned, it's helpful for us to revisit this at different times. And the community advisory committees are here to provide assistance, feedback, and input to county staff as well as the Board of Supervisors, specifically on implementing the Places 29 master plan. And it's our goal to incorporate a variety of perspectives into planning and policy processes. And this provides an avenue for feedback, folks to ask questions and indicate preferences related to development proposals. Though it's important to note that these groups do not have a formal role in the legislative development review process. I'll talk about that a bit more later this evening. The formal bodies that do have a role in this process are the Planning Commission and the Board of Supervisors. And everyone knows our liaisons are here with us that are part of those groups. So as CAC members, you are liaisons to your community, and we ask that you work with the communities that you are a part of, the organizations and your neighborhoods to gather input and bring this to the attention of staff on a variety of topics and to distribute information back to your networks. And we look to CACs to provide advisory input, comments, and information on policies, projects, and programs. And again, the master plan for this area is the Places 29 master plan, and we look to the CACs for support in implementing them. So there are 7 CACs that currently exist, and 3 of them are within the Places 29 area because the area is so large. So Hydraulic is one. We also have Brio and North CACs. And you all know that there are 3 officer positions. The chair for this group is Cynthia Neff, and the chair works with me, the staff liaison, on setting up agendas for the meetings and presides over the meeting. We also have vice chair, which is Yolanda Speed for this group, and Yolanda supports when Cynthia is not able to attend and is another support person as the chair. And then there's also a secretary, which is Rosemary Miller for this group, and very important job of keeping track of minutes for us all to review and keeps a record of the group's business. I'll just speed through this really quick. There's monthly meetings, and agendas typically contain a similar set of items. And there's, on occasion, we'll have rules of procedure that come into play, specifically with typically adopting minutes is the most frequent time that CACs will take a motion or an action, and Cynthia will often, with the minutes, ask for a motion to approve the minutes and a second, and then a voice vote occurs. It's important to note that CACs are not required or necessarily even recommended to take votes on policies, programs, or proposals, given that there's not a formal role for these groups in the legislative review process that is really the Planning Commission and the Board of Supervisors role for those projects, though development proposals seek the input of CAC members. So this is really the center of the presentation here is the Freedom of Information Act and the Conflict of Interest Act information. And this is because community advisory committees are public bodies. So these federal acts apply to public bodies. And what's important about FOIA, or the Freedom of Information Act, is that we have to, as staff, provide notice to the public when a meeting is going to happen. And that notice takes place at least 3 days prior. So when I send out an email with the agenda, that also is posted on the Albemarle County website. It's posted in the building. There are different requirements that Albemarle County has to make sure that meetings are open to the public. So even though we're in a virtual setting right now, anyone can listen in and still participate in a virtual way. We also need to take minutes to keep track of the date and time, people that are present, and the matters that were discussed. And an important nuance to FOIA is whether it's a meeting. So since public bodies need to provide ample notice when a meeting occurs, what is a meeting? A meeting is when 3 or more members of the CAC are physically assembled for the purpose of discussing or transacting business of the CAC. So while we're not physically assembled now, I'll get into what that looks like for virtual settings. But it's important to note here that you might get together with 2 other CAC members, but you're not talking about CAC business. You're at pre-COVID at like a sports event or something. That's not a meeting. It's when you're specifically discussing business of the CAC. And email is typically a circumstance now that we're all meeting virtually where you might ask yourself whether it's a meeting. And Virginia has 2 conditions for when a virtual meeting is occurring. It's when 3 or more members are simultaneously discussing CAC business. And so this does include email, and the issue is just generally when there's back and forth email responses. You can certainly feel free to email out to the group ideas you might have for a future meeting topic or forward something, but generally back and forth communication, we would discourage that due to this FOIA legislation. So that is the FOIA piece, just about making sure that meetings are noticed and available to members of the public, and all of the information is publicly accessible. The second piece of legislation that applies to this group is the Conflict of Interest Act, and I'll do my best to summarize this, though if specific questions come up, sometimes I need to defer to my county attorney's office colleagues, because there might be specific questions that you all have and I can follow up with you. But Conflict of Interest Act applies to committee members that may have what's called a personal interest in a transaction. So that means when you might have an immediate family member or you yourself owns property or a business that's involved in a specific topic that the CAC is discussing, you are required to disclose your personal interest. And there's a few different situations where this doesn't apply. So if an item to be discussed affects the public generally, so it's not your property, but a broader neighborhood that you live within, that's not a situation where this applies. Or if you're a member of a broader business organization, you're not the specific owner, that doesn't necessarily apply. So again, if you have a concern about an item that is before the Hydraulic CAC and you think you might have what's noted here as a personal interest, feel free to reach out to me and we can coordinate with the county attorney's office and see if that's something that you would need to disclose to the group. So I will stop there for questions. And I see Bill's hand is up, so go ahead, Bill.
When I was in New York, the public meetings portion of the FOIA law there had an interpretation about not simultaneous meetings, but because I noticed that word appeared in on your slide, but if let's say 2 members had a discussion on some matter, and then they on a phone call, and then one of them called somebody else and they had the same discussion, and they called somebody, that was considered a violation. Because you could end up with a decision with no more than 2 people, an illegal decision that was not public, with no more than 2 people involved in the conversation at any one time. So I wonder if that would be a violation under the Virginia FOIA.
That's a good question. I haven't heard that example shared to me from the county attorney's office, but we do have a handbook to this policy with a few different examples of scenarios that I can definitely share with you all. It kind of details out different circumstances where it might be violating FOIA, but I think just generally good practice is if it's CAC business and you're not doing it during a meeting, it's probably best to check in with Cynthia about a future meeting topic, or just feel free to email me a question. I'm definitely not the expert on this, but I can look into that.
Anyone else? Thank you. I think that was a good lesson. I think it triggered a few things for a couple of us. So now the other thing that Michaela was going to take us through was that just kind of an overview of the development process, which, you know, most people aren't aware of and are sometimes surprised when they find out, you know, what all is entailed. So we'll take a few minutes on that and get a little smarter.
All right, part 2 of this evening for me is how does development happen in Albemarle County? And I will, towards the end of the presentation, go through an online tool that's available. So if you want to pass this on to your neighbors and family members and friends about how you might access information about the development review process or what's happening around you, it's on the county website, though, as Cynthia mentioned, folks might not know where to access it right now. Generally, this is an overview of the development review process in Albemarle County. And in the last presentation, I used this term legislative review a few times. And what that really refers to is when a property owner seeks to change the zoning on their property or to do one of the special uses that are listed in their zoning district. And any project that's applying to do that needs to have approval from the Board of Supervisors before they can really begin the rest of the development review process. So that's why there's this dotted line here to say, you know, it's going through this pending potential approval or denial process. But projects that are really just seeking to do something that they're already permitted to do, you'll sometimes hear staff call this a by right application, meaning they already have the rights to do what they seek to do. They submit a site design to Albemarle County, and a variety of reviewers at the county and at the state level review an application to make sure it's compliant with all of the applicable laws and regulations. So they have to submit an initial and a final site plan, and that is all before they seek a building permit and go through the construction process, and ultimately need to have a certificate of occupancy or a CO approved before they can be built or operating. This might look like a simple process, but this is the graphic that when I first started the county, I mapped out the process to understand how it might happen. And we're not going to go through all of this in detail, but it just is here to show that there are a number of reviewers in place when someone is seeking to do something that they're already allowed to do under current laws. And there's also a whole separate stream at the top of the screen to show what happens when someone's applying to do something different, like a rezoning or a special use permit.
I bet John Neal could go through it with you.
I'll pass it over to John. But I'm using a couple terms that may not be familiar to everyone. Zoning is a term that you'll probably hear frequently as a member of this group. And zoning is a policy tool that most cities and counties have that groups properties into zones based on the uses that are permitted and some design aspects of the site as well. And the goal of zoning as a policy is to protect the health, safety, and welfare of its residents. And this, again, is something most localities have across the United States. And this is the policy that dictates what a property owner can do today. By right is a term that I hear folks use a lot locally, so I wanted to make sure this was in the presentation in case you all hear that. And zoning is different than the comprehensive plan. The comprehensive plan is an overarching document that establishes a 20-year vision for the county. It contains overarching policies and recommendations, and you've probably also heard of or seen the Places 29 Master Plan, as well as the Rio 29 Small Area Plan. These are more local, these are smaller planning areas that are embedded within the Places 29 Master Plan. You can kind of think of it like a nesting doll, in that there's an overarching comprehensive plan Within it, there's a Places 29 master plan, and within that, there's a RIO 29 small area plan. The geographic area gets smaller as you think about those different plans. And these policies and plans and recommendations are developed through extensive engagement with community members, especially those that are most directly affected and surrounding an area or using it. This map here is a portion of the comprehensive plan's future land use plan. Each of the areas in color are the county's designated development areas, whereas the areas in white are still part of the county, though they are the rural areas of the county. And for decades, Albemarle County has had a growth management policy that directs development into the areas that are in different colors, the development areas, while maintaining the remainder of the county as a rural land use. And so the growth management policy is implemented through a variety of land use and fiscal tools, the zoning ordinance being one of those main ways that this policy is implemented. And as I mentioned, each development area has a master plan, and it contains a future land use recommendation for every single property. This is an example of the north side of Places 29. This is around the airport, and you can see there are different colors assigned to each property. For example, yellow is neighborhood density residential, and the purple is office and research and development and light industrial. The Places 29 development area also includes the RIO 29 small area plan. And this is a page from the plan. And I show it here to show how the county's planning documents have evolved over its planning history. This document is the most design oriented in the sense that it focuses on the form of buildings and how they interact and meet the street, and is less focused on the uses of properties. And so I provided an overview of zoning and land use and how they're different. And sometimes they don't line up, given that on the left, you can see the zoning is what property owners can do today. And those colors look different than the future land use for a property. And so sometimes when an application comes before the community advisory committee and there's a community meeting, the applicant will share information about a property's zoning and its land use. And county staff looks to see if a proposal is aligned with the future land use that's recommended in these long-range planning documents. I've started to talk about this a little, but this legislative review process where a property owner is seeking to develop a use on their property that's listed as a special use, or to change their zoning district entirely, Board of Supervisors approval is needed for these type of applications, and we refer to it as legislative review. So in addition to the Planning Commission and the Board of Supervisors, county staff and other local and regional agencies review these applications and provide staff comments and recommendations. And then this is compiled into a staff report that's prepared for the Planning Commission, who provides a recommendation to the Board of Supervisors to ultimately approve, deny, or defer an application. And CACs are a public body that deals with legislative review applications specifically, as typically they are the host to community meetings for projects within their area. So developers and applicants are required as part of that process to host a community meeting. And typically this is a convenient forum for those applicants to do it. They invite surrounding property owners as well as CAC members to share their input on a proposed project. And the applicant also shares information about the project, and county staff share information about relevant policies and regulations and the process for that specific application. And the last portion of the presentation is about this tool that's available on the county website called the Development Dashboards. When you're on the Albemarle County website, on the upper right-hand corner, there's a tab, How Do I? And the drop-down, there's a drop-down that says Development Dashboard. And when you click on that, it brings you to this page. And at the bottom of this image, you're able to expand and use this tool that that lets you view the applications that are pending or going through the development review process in your area. There's also resources at the bottom of that same page where you can view the diagram that I shared at the beginning of the presentation, and you can view maps that they're static maps, so they're updated 2 times a year in January and July of your area. So if you want to print something and view it, that's available too. But the tool itself, you're able to flip through using arrows at the upper left and right hand of your screen. You're able to see which applications are at different stages of this development review process. And here I took a screenshot of sorting applications by the Places 29 Hydraulic CAC area. There's also underneath it's hidden magisterial district. There's also elementary school district, and then comp plan area, which would be Places 29 for this area. So it tells you as of when this program was last updated that applications and their count are at each stage of the process. And you can see what is in the legislative review docket right now. And this is a good example of a project that's shown here that's just deferred indefinitely. So it'll say the status here. So this is an application that's sitting at the county, but the applicant is not currently acting on. But this would be the place where you would see projects in the hydraulic CAC area that are currently in the process of being reviewed by the Planning Commission and the Board of Supervisors. And again, this is something that I definitely recommend taking a look at on your own time, because there's a lot of ways that you can look at information. This is still sorted by hydraulic. You can see the number of units that are approved to be built in an area and where which applications they fall within. The site design review process here is one for projects that are already approved and they've submitted an initial site plan to the county and they're working through making sure they're compliant with all of the relevant policies. So these, I just included screenshots of each of the pages of this tool, and the one that I find is the most useful is the overarching just project and application info part of the website, because you can click on the individual applications and pull up those documents. Say you wanted to really dive in and see what the proposed application, what they're actually doing on the site, you can click on that and see it. So that's
great.
The end of my presentation. It's a lot of information. I'll share it with you all after tonight's meeting and share the link to that. So I'm happy to take any questions that came to mind.
I have an observation. I think the comp plan is very well done. And it gives the public a lot of time to input. And the county increases in population 1,500 people a year. And this comp plan is intended to absorb those people. And I'm gonna say they've done a terrific job. We should be very proud of the way it's done.
Yeah.
A lot of public input.
Thank you, Vito.
I'll tell you the thing that I can remember when, 10 years ago, when the master plan in Places 29 was really, you would ask the question, well, how many projects have already been approved 5 years ago and just aren't built yet?
Mm-hmm.
And you know, nobody had that. And then now you look at this and it's like, whoa. So John, did you think I was picking on you? Did you? So John is
on me at all.
just part of the, you know, development community. So it's important, and as is Vito. So it's important to get their perspectives.
No, not picking on me at all. I'm very thankful that Michaela was running that presentation. I didn't have to try to explain what the heck was going on.
Yeah.
Easy enough.
Yeah.
Let me just add one thing for clarity for everybody. And Michaela, you did an outstanding job. You really, that was wonderful. Thank you very much. I just wanted to clarify for folks, because sometimes people they get a little confused. Just like our schools are not, our public schools in Albemarle County do not have children from just one magisterial district. You know, they have multiple magisterial districts that send children to a school. Our CAC, our Hydraulic CAC, is not made up of representatives that just live in the Jack Jewett district. And that has caused a little bit of confusion at times. And I'll tell you what happened. Years ago, when we were trying to divide up how these lines would be drawn for the North and the Hydraulic and the Rio, at the time, Brad Sheffield was the supervisor for Rio. And we got together and said with staff and said, it would be so much easier for the CACs if we could just take everybody on one side of 29 and put them in before you get to the bridge, right? I mean, into a CAC, and then everybody on the other side of that. Well, I just want to point out that Kim actually lives in the Rio district, but not the Jack Jewett district, but she's on our CAC. And I just, so that people understand that there is some overlap with the districts, that's all.
And Yolanda's also in my neighborhood, so she.
That's right,
Yeah,
Yolanda
we're both
is in her neighborhood as well. So I just wanted people, when we're talking about the lines and everything, so folks understand.
Anybody else? I thought that was really interesting as well. Well, so now we've saved some time for did you have a question, John? Or you were just, no?
That probably was me, I think. I forgot to mention that the online development dashboards is something that staff manually updates right now. It's not automated. That's our ultimate goal for this. But if you have any questions on a specific project, please reach out to me and I can direct you to the person that's reviewing the project. And I know any number of specific questions come up and I won't be able to answer all of them, but I can direct you to someone that can. So because
Michaela,
go ahead.
This is a great tool to have. And I know, just as an example, the proposal that we saw a few weeks ago, the townhomes going up across from Georgetown Green. So if one of my neighbors was like, what's going on over there? Then they could go to the dashboard and see the project, look it up either by address or just by region to see the status and maybe kind of somewhat of a timeline.
Mm-hmm. Yes, and because we do our best to keep up with it, but it is only updated twice a year comprehensively. It's good to just reach out to county staff if there's an aspect of a project that you have a question about or the specific timeline on when they're waiting for comments back from staff and things like that. It doesn't go to that level of detail.
That's really helpful to know. Okay, thank you. It's a great tool to have.
So before we move on to liaison updates, I just also wanted to add, one of the other things that's really changed over the years is the county staff. And I just want to say we are very lucky to have Michaela Arcardi as our staff person. She is amazing. She takes very good care of us and keeps us, you know, on the straight and narrow, or at least as straight and narrow as we can get. So anyway, thank you very much, Michaela. You're a doll. Okay, so do we have any updates? Well, first I'll let Diantha or Julian speak up.
Oh, and I'm going to jump in, Cynthia, because since Sam is here, and I know everybody's always interested in Stonefield. I've asked Sam if she could just give us a quick update on Stonefield and the picture and the landscape at Stonefield right now, because I think people will be interested.
Yeah, great update.
Yeah, so thank you all for letting me be a part of this. I know with Tori, I've told Diantha I have big shoes to fill because she was very involved and great, but hopefully I can pick up and keep carrying her torch well. We are excited at Stonefield. We do have some new leases that are going to be starting, so we have some businesses coming in. We are very excited to announce, I just delivered her keys to her a week ago. PK Ross, who owns Splendora's, that a lot of people may have been familiar with on the downtown mall for many years, she will be coming to Stonefield. So she will be opening her doors in February. We're assisting her in building her space out, and we're so excited to have her local gelato shop with us.
Wow.
So that is a big one for us locally because I love her and I love that shop. So selfishly, that's exciting. We are also starting construction on a new sunglass hut. So that's going to be opening up in the space next to Vineyard Vines and Kendra Scott. So that's going to be a new business that's going to be coming in. And I'm really excited. When I took this job over, one thing Tori and Diantha told me is this group is very interested in the theater. And and I can see why. I don't blame you. You should be. And I did have a meeting this morning and they are still scheduled. I was alerted by my asset manager in our meeting to prepare to get a phone call from the general manager of Regal, because all intents and purposes is they will be open in April. And she is going to reach out to me to start coming in and doing some work. And here in the coming months, she's going to have some things that she's going to need from me. So he alerted me to be ready to hear from her. And I said, well, I thought you were going to say they're pushing it to May or June. So that was very exciting news. I didn't expect that. So we're very excited about that. I'm starting up some of our landscaping projects again that we had kind of taken a back seat on during COVID and everything. Those are all up and running starting this month going forward. So we're excited to get some fresh air going into the spring at Stonefield. So, and please, no one hesitate to reach out to me if you have any questions. I'm here.
Is there still a plan for the hotel that's next door to the Burger Bach?
The Hyatt?
Yeah.
I
don't know. I just know that there was a plan, a proposal for a hotel there. I was
They
just
were
wondering if it
On
was
the green,
still-
on the
They were
green
gonna build a
space.
second hotel, an expansion of a suite-like hotel, Sam.
Oh, onto the green space. Is that
Yeah.
the spot?
Which everybody was
So,
a little sad about, but
so here's what I can say. Because I have been very well instructed that I can never say nothing will ever be built on that green space ever. I can't say that. But I can tell you that for the foreseeable future that we have, that green space is where it is. It's not going anywhere. So don't worry. I can't say that it'll never, ever happen. But I can tell you for the foreseeable future, I'm already trying to plan some concerts out there for this summer. We're hoping to do a COVID-friendly Easter egg hunt with Movement Church again this year. I'm meeting with Jeff to figure out how to do that. So we're already have some plans going into spring and summer to use that space. We're going to host Girls on the Run starting in March. So that space isn't going anywhere anytime soon.
oh, good. Well,
I
thank you.
would like to add that I am currently working with Sam on a art project involve the two transit stops at Stonefield, the one at Costco and the one there by the Hyatt. And what we're hoping, you probably won't see anything happen until spring because we need to put down a concrete pad at the Hyatt for the transit stop because right now it's just a pole in the ground. But that project is moving forward. It's just been slowed down a lot by COVID, but we have it moving again and we're hopeful that it will come to fruition at some point, which will be great fun to have an art project there. So
Yes.
yes.
Cool. So do you have anything else, Diantha?
I guess while I can go on and just talk and then Julian can jump in. I did want to let folks know we are really excited because, you all will remember we had a panel and public meetings, and I was on the panel representing our community around the transportation projects for the hydraulic intersection. And we brought forth a packet of projects to be funded through Smart Scale, which is the VDOT funding mechanism. Those projects for the hydraulic intersection have made the first cut, which is exciting in a positive way. So VDOT has agreed to fund all of those projects that we have, well, all but one, and I'll talk about that in a minute. But the vast majority of those projects around the hydraulic intersection. Now, it still has to go through some more steps, but once VDOT picks you as a project to be funded, you pretty much are very hopeful to get the projects done. So let me run through that. So what that means is that we will have a roundabout built at Hillsdale. Now, Hillsdale, is where, if you think about Kmart and where they split below Kmart, so Hillsdale comes out that way, right? So we'll have a roundabout there. We will have a pedestrian and bicycle overpass going over 29, which I am thrilled about, because bikers and pedestrians will be able to go from our side of 29 to the other side of 29, which is actually in the city, but it will be a wonderful quality of life, economic development. I mean, the synergy will be great. We were hoping to have it support a transit bus, but we couldn't get VDOT to agree to that. So anyway, but it's going to be bike and pedestrian, which is great. And then along with that, funded were the bus pullout for if you think about a pedestrian bridge, you will have to have access. So they have funded a bus pullout along there so that the buses can actually pull in and not block traffic and stop for those for that pedestrian bridge, which is great. Also funded was when these projects roll out, you're not going to be able to take a left turn from hydraulic onto 29. And the reason is because that's what causes the majority of the fatalities and the crashes. That intersection is the most dangerous in the Culpeper district. You'll have to figure out another way, and there are other ways. And then, let me think a minute, what else? It protects the left turn lane from Angus. If you think about Angus Road, down at what I call Chicken Row. Anyway, from Angus.
It's a chicken strip.
Yeah, it's Chicken Row, whatever. Right. From Angus, a left turn lane across 29. So you'll be able to make a safe turn there, which will help a lot, I think. What was not funded that we had hoped to have funded in this package was if you think about trying to get a connection from Hillsdale, where the roundabout is, to go to the 29 bypass. That was a pretty expensive, and that was not funded. So we will probably be planning on coming back for that improvement at another date with another round of Smart Scale funding. The other project that we talked about, and we will probably be revisiting as well, is the roundabout that you heard about at District Avenue, which is up near Sam Stonefield. You know how you come out where District Avenue comes right there by the theater. It's sort of there. If you think about the theater, you see the theater, and we want a roundabout there because it's causing a lot of U-turns and just a lot of traffic fender benders. But it's very exciting that we've gotten this far with that package of improvements. It'll really help our district and our community a lot. Had some other things.
Bill had a question. Bill.
Oh, I'm sorry, Bill.
I just wanted to know, on the pedestrian bridge, at some point, will we get some sort of a design of what it's going to look like that we might be able to offer comments on?
Yeah, we'll see more detailed design on all of these. VDOT has not while we have basic designs that were drawings, VDOT doesn't spend a whole lot of time going into design absolutes until something's been approved and they know they're going to actually build it, which makes sense. So we'll make sure that this group is included in all that. Absolutely, Bill. It'll be fun. John?
I had a question about the limiting the left turns on hydraulic on the 29. Is that going 29 north from our side, or is it going the other way, going south?
I thought it was from our side.
Yeah, I think you can't go north on 29, but
That's right. It's not right. It's north. That's my understanding. Yes.
But if you're coming from the new circle at Whole Foods, you can go left.
Absolutely. And you come up the door. Yes, that's exact. And that's why they're providing other ways to do it. They just want us to stop going across there and having all those T-bones and all those wrecks. Yeah.
Right.
Yes, exactly.
Okay.
What's the timeline for this? Like, when do they anticipate? Is this 4 years, 5 years?
That's a good question. And let me see if I can find that in my notes. I think these are
Years.
It's 22, it's funding for 22 to 28. Does that help?
Yeah, that's about 5 years. Yeah.
Yes. So they're going to have to do the design. They have to do all of the work, you know. So it's in that funding piece and infrastructure plan for 22 to 28.
Do they
John
feel
had a
like
question?
Hey,
John?
Dante, has there been any talk with the city in terms of like Greenway extending now that the Zan Road bridge may come into play? Because the city's been working on getting the Greenway to Whole Foods.
Right. And we'll have to have those discussions, John. I mean, we haven't had anything yet. I mean, we didn't even know.
Yeah. It's very exciting. So
yeah.
all good news.
That's cool.
Absolutely. Yeah.
Kim, did you have something else?
Yeah. So is there any like worry about property not being like available to do this, or is this, are all of the property owners going to be agreeable to this bridge, or is that going to be
North of Griffin
issue?
and Stonefield supported it. We even had letters of support from them.
What about on the other side?
I'll have to speak to, John may know more about that than I do, but in fact, the Great Eastern Management was at the table as part of this process. So our understanding is that yes, that they were in favor of it. Now, details yet to come. I don't know exactly where it's going to go, right? We don't know exactly how it'll work, but we had all those folks at the table with us.
All right. Well, that's good. Hopefully there won't be any hiccups there.
Yeah.
Okay, we're running out of time, kids. You know what happens when you come between me and my wine.
And I want to just say one quick thing, because I think this group will like it. I want to make sure you know, and I'm sorry, Cynthia, but Albemarle County now has, in case you haven't heard, a contract with the city. We're partnering with the city to get some of our urban ring roads swept with street sweepers, because Albemarle County doesn't own any street sweepers. And I just wanted to let you know, I'm pretty excited about this, because Hydraulic Road, Georgetown Road, and Barracks Road are three of the roads in the Jewett district that are targeted for this. And it means that we'll have street sweepers out I think twice, it's only twice a year, right? But it's good news. And so you may see those sweepers out and around at some point as you're moving. And it will help with bicycles to get all of that debris off of the side of the road. So I'm pretty excited. And
Yeah, it's funny because I noticed that today. And I was driving down and it's like, oh my God, somebody needs to cut this back.
Right. So that's a real positive. And the only other quick thing I will want to tell you is that the sidewalk project on Lambs Lane campus that you all funded is moving forward. They have a design that is in concert with the new Boys and Girls Club. So the sidewalk can be built, the Boys and Girls Club can be built, and they're not going to interfere with each other. They will, they will add to one another. And we're supposed to hear back on the bids January the 29th. So that's still with bids, but just to give you an update, right?
That's great.
Okay.
Julian?
I'm going to be very quick. So John, John Lewis, I can tell you, I used to sit on the MPO Tech, and I can tell you that the city was very much aware and may in fact have received some funding to connect the Greenway. And so while it's not in our purview, yeah, if we can go there, if I can find the notes, well, I don't have the notes because I'm not the decision maker, but I can tell you I've been in discussions with that, so you should know that.
That's great.
The other thing, I just want to make it very clear. I know that the presentation that Michaela did felt like a lot of information, but I can tell you and join with Diantha that she did an absolutely brilliant job. And, so you should be aware that we are not only well served here at our committee, at our CAC, but those of us who are engaged actively and deeply in the planning process of Albemarle County, we have people like Michaela and her colleagues who help to not only make this go at a speed and at a pace that sometimes is blinding, but also in a way that also helps us to digest it. But I'm also going to just suggest one thing. So you should also know, and this is for Rosemary. Rosemary, I will share with you that sitting on the Planning Commission, I have learned to appreciate that even though we may pass something and it goes before the supervisors, it may never get built. It may never get built. The property may be sold to someone else. And this is the thing that the staff has had to sort of calm me down. It's like, we did all this work and then what are we going to do with this? Well, you never know. The property gets sold. And like the piece of property on the corner of Georgetown and Hydraulic that we all thought was going to be this sort of wooded area, Diantha and I and some other individuals have been engaged. And I think, Diantha, what did you say that had been passed in 2008? Is that when that
Passed in 2004, I
in
believe.
2004. So this is a project, just to give us some sense. Projects can sit there thinking, perking, doing all the things. Although if John Neal was involved, we would know it had already been done. But these things they sit in there, and we won't even talk about Vito because Vito's like got the plan. He's got the crew there waiting to push it all. But these are things that we see, we get involved with, we get exercised about, and then all of a sudden there may be this fallow time before something pops up. And the reason I'm saying that is that we all had a hand, and in fact, I think many of us, and Michaela has had a hand in this, in the form-based code project on Route 29, at Ryan 29. That's huge. I will say there's lots of people who are citizens, well, what, Crozet's doing this, Pantops is doing this. If we pull this off, and the supervisors have been thinking dearly and clearly about this, the placemaking that could happen at Rio and 29 would be absolutely brilliant, and a repackaging of that space in ways that will serve our community for years. So while we're doing other things in other places, and I get that, what we're really doing is I think we're really having an impact on how we use the land right there on our borders between the various districts. And on that, Chair,
Thank you, Julia. That's exactly right.
Yeah, you're good. Does anybody else have anything they want to contribute or add?
This may be slightly off topic, but everybody's talking about the county is doing a great job, and I completely agree. We do a lot of business in the county, some of the surrounding areas, and with the city. And I would just chime in to say that the comparison between how the county has handled the last 10 months compared with the city is night and day. I mean, you got a 2-hour window on Fridays to submit a plan with the city, and that's it. Where the county is completely, for the most part, online and submitting and doing stuff and rock and roll like most of other businesses in the area to survive and to serve. And that is in stark contrast to what's happening in the city. So the county definitely should be commended for that.
That's great.
Thank you, John.
I was going to wish we would have taped all this.
Our staff has really tried to keep us moving, and the board of supervisors has said, we want people to keep their jobs. We want, it's all about, the health and welfare of our community, and we're going to keep on going. So thanks.
That was great. Well, if there's nothing else,
That's it.
we're
Your
going
dog
to
is looking at you.
bid adieu, and we will see each other actually in 3 weeks, is because this one got delayed by a week because of Martin Luther King. So we will have a fun agenda next month. So it's lovely seeing all of you people today. Bye-bye.
Stay safe.
Thanks.
Bye-bye.